Okay, right now we've got about 40 people joined in, which is awesome. I'm going to do a quick intro. Yeah. So hello, everyone. Thank you for joining. My name is Ruby, and I'm an academic recruiter. I work for Aspen Dental Management. And there's two entities to Aspen Dental. There's Aspen Dental Management, who I work for, who Jeff works for. We're the support team kind of behind the scenes of Aspen Dental, which is where our doctors are, where they have to, where they focus on their primary thing, which would be patient care. So we're here to support them in any kind of needs that they might have. We are a DSO, a dental support organization. We have roughly 800 plus offices across the US and continuing to grow. And yeah, that's my little spiel about Aspen. But before we begin, I have a question and answer box on the bottom. So feel free to submit any questions you might have, and I will go ahead and have Dr. Nadia or Jeff answer them. And you'll often see me looking at two screens, and that's just because all your questions are on the second screen I have. There's no one there. It's just how I can organize all of this. I will be the moderator for today. If you do have any questions that you want to ask privately, feel free to email me. But other than that, we will begin, and I'll have each of you introduce yourselves. I'll start with Jeff, if you could introduce yourself, and then we'll get to Doc after.
Yeah. Hi, everyone. I'm Jeff Gehring. I've been with Aspen a little over 4 years in August. My territory is Ohio, West and Virginia. So I support roughly 45 to 50 offices, and I do have the ability to place doctors all over the country. So, if you're looking for anything, or if you know anybody that's interested, please feel free to send them my way, and I'd be more than happy to help them out.
Thanks, Jeff. Dr. Nadia, if you could tell us a little bit about yourself.
Hi, everybody. Dr. Nadia. I'm the MCD for one of the Cincinnati offices. I joined Aspen in the summer of 2019. Worked in a couple of their offices, and now in the Northgate office.
Oh, Dr. Nadia, it's cutting a little. Oops.
Free to ask me anything.
Dr. Nadia, sorry, it looked like it glitched.
Yeah, there we go. Yeah.
Sorry, if you could redo or just repeat yourself, it glitched.
Okay. All right. Dr. Nadia, the MCD for one of the Cincinnati offices. I joined Aspen Dental in summer of 2019, and since then worked in two of their offices. I have an associate that works with me. Feel free to ask me anything. We can start the session. Yes.
Awesome. So right off the bat, someone asked, how did you become an MCD? And if you could actually expand on what exactly an MCD is.
So it's a managing clinical director. I do have clinical experience. I graduated by 2008. So I guess one of the offices that I started off in, the MCD was actually leaving, and they were looking to replace him. So that's how I got in touch with. And like I said, I think because I have been working for a bunch of years, and they wanted someone clinical experience. So that's how I started off as being an MCD versus becoming an associate and just working on. I also have some experience working on the management side of offices. I used to co-own a private, had some experience.
Awesome. Jeff, could you go a little further on, how does one out of dental school, choosing to be an associate, an MCD, when it comes to recruiting, what are, you've worked with a lot of doctors and a lot of owners, what are they looking for with an associate versus an MCD?
I mean, the typical associate role is probably just for your new grad coming out of school without a residency, that's looking for mentorship and who's looking for something that's maybe a little slower paced, where they could just manage one column of patients, and they could really work on, gaining confidence and gaining clinical speed, as well as, learning a little bit more about the business, that Aspen can offer. I've had some new grads come out of school and dentist positions, and they've absolutely thrived. I think the biggest thing is just finding you a good mentor doctor that's going to be there to support you and guide you with that mentorship and that, some of that clinical support, as well as, having a good operational team. I think that's really important. And then as far as like going from an associate to an MCD, there's really no specific timetable. It's just whenever you feel ready that, to take on that role. People go from associate to lead dentist in 3 months. I've had some people maybe take a year. It just depends on your own personal skills and your confidence level, and as well as, the clinical side of things too.
Awesome. Thanks. So Dr. Nadia, did you have any say in choosing your mentor when you came to Aspen Dental? Or did you even have a mentor because you had the clinical experience already?
No, I did a week orientation, CD Hamilton, learning the Aspen way of things and how the flow is. Have years of clinical experience just to know the flow of these offices and how it's all managed, and just getting to know the dental assistants and all that really helps. So I think pretty much everybody starts off with 4 weeks of orientation, whether they're becoming an associate or an MCD. And since I was just moving to Cincinnati, I honestly didn't know anybody. So I was told that I would, and that was the closest office, like commute wise. They picked the less office of like the least commute for me. So I guess that was what determined the office.
Awesome. And so with your mentor, is it the owner doctor for you?
Yes, that was the owner doctor. Yeah.
Are you still in contact?
How does Dr. Martin?
How does that work? Or I guess now with, the cauldrons and everything, are you in constant communication if you need help?
Yeah. Yes. Yes. Initially, I was in touch with Dr. Martin, but since the cauldrons, the owners of my practice, they're very hands-on. They work once a month. So if I have any questions, case related, management, or just about anything, I text them or call them. They get back to me. So it's a very easy and open communication.
Awesome. Wonderful. What options did you have, coming out of dental school, and what in the end made you choose Aspen?
Coming out of dental school, that was a long time ago. What made me choose, we were actually moving to the Midwest region, and I honestly wanted to go for Aspen. They have a very, very strong support system. So that was one of the reasons. You can get about any sort of training you want. There's a ton of help that you get. It's also like it was in Cincinnati, and I've been, if you want to get trained for implants, you could. They have a very strong Invisalign program. Honestly, just about anything, that I would have support and backup. And these offices are really busy, so you're not, because I've been in offices that smaller or private practices where it's not as busy and you're just sitting, and then you worry about production, and then you worry about that. So I knew at least with here, I would have a full flow. I had spoken to some of my friends who worked in Aspen, and I got very good feedback. So I was like, okay, let's do this.
Awesome. Now, did you look into any other DSOs? And if you had, why Aspen over them?
I did. I worked with Dental Dreams. That was in 2008 for a few years. I did work for another smaller group. They have about 50 practices in Massachusetts and the Connecticut area, New England Family Dentistry. They're all good. The scheduling wasn't as strong, honestly speaking. In my 12, 13 years of clinical experience, I've never seen anybody book the schedule like I see it in these offices. So I would honestly tell any who started their new yet can do full mouth extractions or Invisalign, or if you want to train an implant. So I feel like it's a pretty good, strong practice, and they have good incentive programs. There's, like I said, there's a lot of support. There's a lot of training as well. So since I've had worked for some other DSOs, just based on that, I've seen how they decline, go slow over time. There's not enough training. And that was one of the reasons why I wanted to move away from where I was working in Connecticut. And this seemed like a really good opportunity. So.
Wonderful. Now going off of what you were saying, the scheduling and everything at Aspen, what does a typical day look like for you?
So my day is, it's pretty, so I have my production column, and then there's my associate's production column, and then there are 2 columns for new patients. So there's a hygienist in the offices who would probe the patients. The doctors would do the new patient's exam, the treatment plan. The patients go to the manager or the PSR after that to go over the treatment plans. And then there's an overflow column. Like in my office, there are 2 columns for overflow patients, where you would have your denture steps, crown bridge deliveries, impressions, those small things. We do a lot of full mouth extractions. Aspen sort of reaches out to a lot of those people who have not seen a dentist in 20, 30 plus years. Sometimes you would hear like 40 years. So they're very high needs. A lot of the times we see patients who haven't seen anybody in so long. So a lot of perio, a lot of broken down teeth. So we end up doing a lot of dentures. So we do a lot of extractions. We do a lot of implant dentures as well. We do have those patients who have healthier teeth. So there's tons of Invisalign, but it's a very busy, there's a flow to it. The DAs are very well trained. So that really helps with the overflow. I'm not in 6 rooms at one time. Like I said, that the staff is trained enough that they want to make sure that I'm not pulled away from my production very frequently, so I can concentrate on that. I keep an eye on the schedule. They alert us when there's a new patient and we need to leave. So it's a good busy day. We do all sorts of procedures. So
Awesome. So you're never feeling like burnt out with it. It seems like it's a very strategic way of.
There are days when you would feel burned out regardless. There are days, like especially towards the end of the month, when it gets really crazy busy. But everyone's goal is to have a productive scheduling. So you're not just doing something and you're not as productive and you're just getting burned out. We try to, if we feel like it's coming to that point, we stop and we regroup. Like we say, okay, how can we make it better? There are times when dentistry is physically very demanding, no matter what you do. But so there are ways like we mix it up. And like I said, it really helps that the staff is trained enough to help out with a lot of things. Like they know, like impressions, some of the impressions, some immediate dentures they help out with. So, and we have EFTA, so she can fill the teeth we've drilled. So that kind of helps.
Yeah, that's awesome. I don't think we have that in Michigan, but in Ohio, that's really cool.
Yeah, I love it.
Yeah, that's
I love it.
so convenient. Now, you did
Oh,
talk
yeah.
about, production and all of that stuff. I'm going to transition to Jeff. Can you explain the compensation and pay structure of how it works for associates, lead dentists?
Yeah, so ours is definitely a little unique when it comes to the compensation piece. So all of our doctors, whether they're an MCD, Nadia, or an associate, they get a guaranteed daily pay rate. So that essentially acts as your base, and that never goes away. So whether you see a patient or not, you're going to collect on that daily rate. But what's unique about our company is our doctors aren't paid on their individual compensation. They're paid based off of the entire office's production. So typically, the standard model is 8 to 10%, and lead dentists get 16 to 20%. So it's a smaller percentage, but it's of a much larger number because some of our offices are doing 180,000, 200,000 plus because that includes dentistry, specialty, and hygiene. So it's a total team effort, and you're getting paid off not just what you can produce with your own two hands, but off of the entire office. So it's unique in that the daily rate does act as a daily draw, and then the profit sharing, I like to say it's the icing on the cake. You get that paid out at the end of every month, and there's no salary ceiling. So the better the office, the more compensation our clinicians have the opportunity to make.
Awesome. Thanks. Anything you want to add to that, Dr. Nadia?
Yeah, my office does close to 300K. So, I mean,
200 plus, 300 plus.
yeah. So, I mean, I would honestly say that my incentive is better than anywhere else I've actually worked. Even when I co-owned a practice. So, like I said, it is a collective effort from the oral surgeon to the hygienist to associate MCD, just about everyone. And then the DAs have their own bonus structure. So everybody knows that, do the best for the patient. And the office is busy enough that you actually do. So, like I said, my office does pretty well. And my incentive is pretty good too.
Awesome. Now, with that, we're talking about production, we're talking about patients, overflow, sometimes having a crazy day. Is that controllable? Is that, are you allowing, I guess, do you have full autonomy on your, procedures, on how long you need, on your entire schedule?
Yes, I do. And it's the same goes for my associate. If she feels that she needs more time for a procedure, she gets more time. If she's falling behind, if I can pick up her patient, I would. So honestly, when I started off, and just when I wanted to get a feel for everything, and it takes a while to get into the flow of things. So I said, okay, don't overbook me. Let me get used to the flow. And then we started changing back, like for a crown prep, honestly, it typically takes me 15 minutes, and then my DA would go ahead, scan, and temp on. So associate, when she started off, she said, I need 2 hours for crown prep. And that's what we said, okay. So there's really no pressure. But as the more dentistry you do, the quicker you become and the better it is. But yeah, if I say, I would tell my manager, I can't see this patient and this patient together, reschedule it, give me more time. They just do it. They just do it.
Awesome.
I always say, Dr. Nadia, your best friend in the office is probably your office manager, right?
Yes. She actually is. She
They control the schedule. They're doing your consultations and all of that. So
yeah, I really love my office manager. She's really good. She's really good at consultations, and she listens. She listens. So I feel like honestly, I feel very lucky to be in the office I am. The owner doctors to the manager. So it's I feel like I'm lucky.
That's so wonderful to hear. I just got asked, you mentioned DAs scanning for crowns and then, DAs finishing some procedures and things like that. What is your office like when it comes to technology and it being digital and everything?
We have the iTero in our office. So we scan all crowns. We scan all partials. We basically scan all new patients. So it's really easy to show them what their mouth looks like. And it just helps because when we're talking numbers or surfaces, they don't get what you're saying. So ITero really helps. We just got this in the plant Aspen. So yeah, we have all the, the bells and whistles, and I think they have iTero in most of the offices now. So that's a great tool. It's so much easier. We're just taking impressions really for full dentures or immediate dentures, but everything else gets scanned. All the DAs know how to do that. The doctors get trained too, like for final crown preps, the doctors would scan. But yeah, train on it's 5 minutes.
Sorry, it was a little bit of connectivity issues, but thank you. But so you mentioned impressions and then scans and things like that.
Yeah.
What is the situation with labs? Do you send out, cases to labs? What is the situation for you?
Yeah. So all dentures are made in-house. Full permanent dentures and immediate partial dentures are made in-house. There's a lab in every office. And then we do send out for permanent partials. We scan, we send out for permanent partials. And of course the crowns and bridges and implant crowns, those we send out. The turnaround time is pretty quick. There are days when we get back our crowns in under a week. So partials normally take a little bit longer, like a couple weeks, but the turnaround is very quick. Like in a week or 10 days, we insert the work we do.
Awesome. Now, Jeff, I'm going to direct this question to you.
The dentures, yeah.
Oh, sorry, it cut out. I'm sorry, Dr. Nadia, it had cut out.
And I was just saying, having a lab tech on in-house, it helps with the dentures. Like we can literally sometimes do it in 2 days. So it's good for patients.
Right. Where you don't have to like send anything back and
forth.
No. Yeah. That's so convenient, so awesome. I feel like we've heard of so many stories of patients.
It takes forever. It takes forever sometimes to do a denture, like 6 months, because you're sending back in for every step. By having a lab tech in-house, you can just pretty much do it same day, and
Definitely. So Jeff, I was going to direct this towards you and then also afterwards to Dr. Nadia. When it comes to suggestions for new grads and finding out where they should go, location wise or office wise, any suggestions on how to choose the right office, the right lead dentist to be your mentor? Because during the interview process, you don't really know what they're like. How do you figure that out?
So with Aspen Dental, I think one of the most truest statements I can say is, cosmetically, a lot of our offices, they're going to look the same. It's going to say have Aspen Dental on the front, and inside the offices are going to look just about the same. When you pick an Aspen office, or when you're picking a location for Aspen, you're picking a location and you're picking a team to work with, just because the office is going to be run the same, and physically the building is going to look the same. So find a location and a team that you feel that you can fit and that you can flourish within that office. And then, of course, I think personality is a big deal, right? Just you want to find an owner or a lead dentist, if you're going to be the associate, to find out if your personalities are going to mesh well. And then, of course, spending time with the team. I think the best thing that you could do is shadow an office and meet the team in person and just see how an office runs. That's going to be and most efficient way to learn about Aspen Dental. And, no matter what area you're in, we can find an office for you to shadow. I mean, 860 locations in 43 states, we're going to be able to find something for you to do that. I think that's probably the best way to learn and just really experience culture firsthand.
Thank you. Dr. Nadia, anything to add to that?
Yeah, I was just going to say the same, that first find the city or the state you want to live in. That's important, because I moved here for family, so I knew that that's somewhere I want to be for a long time. And then shadowing, if you're interested in an area or city, you can find out. There's so many Aspens everywhere. I think they opened up the 100th office in Florida, just 100 in Florida.
Yeah.
So, but yeah, I've had a few students actually come in and shadow for a day or 2 days. So, just to see if they like the team. I don't know if you'll be able to meet the owners every time, but yeah, you could shadow the office and see how it's run. That'll, gives you a really good idea.
Definitely. Are there opportunities, someone just asked, are there opportunities to advance within Aspen Dental? I'm assuming as a clinician, not for Jeff and I, but maybe.
Absolutely. Yeah, absolutely. In terms of your position, like you have the MCD, and then you also have the option of owning a practice with Aspen. There is actually an ownership program. Jeff can probably give you more details on that. But with clinical skills, yes, there's a lot of training. You could pretty much train for any procedure or implant. So getting, like I said, owners, how many, 10 practices now? I think there's some who own more than that. So you could probably shed more light on that.
Yeah.
So,
I mean,
Jeff,
there's really a ton of options for you to kind of carve your own path with Aspen Dental. I've had, doctors want to be long-term associates just because that fits their clinical strengths, their work-life balance. I've had some doctors that just want to be the lead, and, they're not interested in partnership or ownership. They're just happy with, the clinical side of things and running their own office. And, certainly, partnership is an opportunity where you could potentially buy a percentage of the practice that you're working in and truly partner with that owner doctor that's there. Or if you were interested in ownership, I mean, we're opening 85 offices this year, and we're planning on opening another 100 offices next year. So we're not looking to slow down, and we're going to be opening offices in newer markets across the country and in the existing markets that we're in now. So there's going to be opportunity where practices are going to pop up that aren't going to have an owner. And one of the questions that I always get is, how quickly can you become an owner? And my response is, if you were, how quickly, can you pick up the model and really, perfect those clinical skills? And are you relocatable? Because we're going to be opening up in all these new markets. So if you were able to, potentially relocate to where some of these newer offices are open, you could definitely become an owner sooner rather than later, just depending on what markets are available. So absolutely, there's opportunity for advancement.
Yeah, like Jeff was saying, it's really dependent on the opportunity, what offices are opening, because someone just asked, what's the process look like for becoming an owner of a practice? I think it's a lot of personality as well, and showing that drive and desire to be an owner.
One of my favorite stories is, and I'm sure everyone maybe heard the name of Dr. Brandon Meckelberg. he started as an associate in Chicago. He was in that role for, maybe 3 months. And then he moved down to Florida where he became the MCD of a practice down there. And he became an owner. I think it was somewhere around like the 10 or 11 month mark. He was 11 months out of school and he owned his first practice. And he just acquired his second practice not too long ago. So, I mean, he had the right mindset. He was he developed those clinical skills, very fast. And he was able to build the teams that he wanted around him in those practices. And now he's a 2 practice owner in Florida. He was originally from, I believe, the Wisconsin, Chicago area, and now he's living in Florida because he saw an opportunity there. So it really just depends on you and I guess your own situation.
Definitely. Thank you, guys. Now the fun question that everyone asks is, how long are the contracts with Aspen? Talk about our contracts, Jeff.
Well, this is a short answer. We don't have a contract. So what we have are standardized letters of agreement. There's no length. You're not signing a 12 or 24 month long agreement or something like that. And I think one of the best things that we offer is there's no non-compete and there's no restricted covenant. And I think, obviously I'm biased, but, we have over 1,300 dentists on staff with us because they want to be on staff with us across the country. They're not locked into some, lengthy contract or where they're going to be penalized, whether it be monetarily or, with a restricted covenant or not if they were to leave early. So, I mean, that's basically it. It's an open-ended letter of agreement. And yeah, obviously I'm biased, but yeah, I'm a big fan favorite of it.
Dr. Nadia, anything you'd like to add to it? What did you see on it? Was it, anything you want to add?
So I honestly, I feel this is better because the places I've worked before, they had the 90-day and you're leaving, so there are two sides to it. You're scared, oh, there's no contract, nobody's obligated or bound. But then again, I feel like from my past experience, this is better because if you don't want to be there, then I mean, it's not a good situation for anybody. If you want to leave, let them know it's, you leave. So there's no restrictions or nothing. So it's, you honestly, if you want to stay and work there, you stay and work there. So I feel this is better than what I've been through before. Like, if, just you're bound and you're miserable and you want to move forward, but you can't because you're obligated to. So.
Well, thank you for bringing that up. Exactly. I mean, at the end of the day, the patient's the most important person in the practice. Without patients, none of us would have a job. And if you feel like you're locked into an unfair contract and you're not happy, are you really going to do your best work? And that's, that goes for everybody: office manager, dentist, PSR, dental assistants, that goes for everyone across the board. So, that's another reason why, I feel like it's very unique, but at the same time, I think it benefits everyone.
Definitely. And we just got asked how much notice do you have to give before leaving an office? And it's, just the standard procedure would be like, wanting to do at least 1, 2, 3 months, since you guys are higher professionals. It's a little bit more difficult to find someone to replace. It's not the standard 2 weeks that you would do out of respect at an average job, but as a dentist, as a clinician, we would probably like a little bit more notice just for our patient's sake, to find, the right person for that office.
My response to that question is, provide us with as much as you can, right? And certainly more is always better, just because of, as you said, Ruby, for patient continuity reasons. We build our schedules out sometimes, 30 days in advance, if not more, depending on how busy the practice is. So, trying to, finding a doctor to, potentially, backfill your position and come in and, continue to provide that care. If you can give us 30, 60, 90 days, great. But yeah, that's always as much as you can give us is the best answer that I could probably provide you with right now.
Wonderful. Thank you. Okay, this is kind of a fun question, Dr. Nadia. What are you enjoying about dentistry, or what is your favorite thing about dentistry?
About dentistry, um, I'm surprised myself, but I kind of like extractions. I honestly, I didn't, and I never thought I would say that. In private practice, I would almost always refer out. Um, since starting with Aspen, you start doing them, and then, I mean, I honestly don't enjoy fillings anymore. That's my least favorite. I I feel like it's tedious and it's too time consuming. The FDA helps now, but I honestly like the full mouth and the extraction and the insertion, and it's exciting for the patients too. They do have to go through the healing process, but just when you put it in and they have a nice smile, it's like, oh my God, they start crying. So I mean, it's fun, and it gets easier the more you do it. um, I do like the crown and bridge part as well. um, like I said, fillings least favorite. um, but I do like more of the heavier stuff now. Invisalign is another fun thing. It's with Aspen, it's quick. We normally do cases that we can finish within a year. We do have an orthodontist on board, and so it's very simple. You submit a case. Dr. Galante would tweak it, we start the case. So it's so simple and easy. Invisalign would scare someone who, if you're not doing it, but it's just so simple here. Once you start doing it, and it's fun. It's fun. You see, even like people with no upper teeth and just the lower teeth, we give them a denture on the top, Invisalign on the bottom. It's fun. It's fun straightening and just helping them out. So yeah.
That's wonderful.
As long as they're wearing their trays, right?
Oh yeah. Yeah. You gotta be on them. But most people, we are mostly dealing with adult patients, so they're investing. They're the ones paying for it, so they keep their trays on. I mean, for your kid, they don't care because the parents are paying for it. But most of our patients are like older adults, and they know if they pay for it, they need to keep it in. So
Definitely. What challenges do you face on the day-to-day, and how do you overcome them?
So, honestly, I feel that it is getting better. Initially, when I started, to tell you the truth, just managing the flow was tough, because there's your production column, then you have to do the new patient exams, and I don't like to rush my exams. Like, I don't want the patients to feel like I said open your mouth, and bro, then I leave. And then there's the overflow column where, you still need to go there. Sometimes you need to tackle crown deliveries, or I feel with iTero, it's much better now with crowns. We don't really have to adjust crowns and partials as much. But initially it's really tackling that flow when you go in, and if you're not Aspenized, I would say, you look at that schedule and you see 6 columns, it can get overwhelming. um, but now it's much easier. The thing is, my manager knows what I can handle and what would make me mad. So honestly, we're in sync with each other, even the associates. So the staff knows that this is what the doctor expects and this is what they would want to see. There are days when it gets crazy and we're like, what is going on? But we know those are the exceptions, not the norm. We work on it. It's getting better. There are days when I'm frustrated, I get mad, I get tired, but those are honestly they're rare days. Initially, it took me a while to get in the flow. It's much better now.
That's
Much better now. Yeah. Like I prepped 8 crowns today with some other stuff. I did not even feel it. Like and I left early today because I had this Zoom meeting. So initially, like 8 crowns. Oh my God, how am I going to 8 crowns? it gets easy. Yeah. So yeah.
That's awesome. So I guess for students that are, like listening to this, I'm sure your advice would be like, not to really freak out initially when you start working and getting into the real
Yeah, don't freak out. Don't freak out. Yeah, nobody's gonna push you or pressure. My biggest thing is I hate when patients wait. That's something that gives me stress, honestly. When I feel if I'm getting backed up or they're like four new patients waiting for exams. So I try to just keep an eye on the schedule and eliminate that, because that's one thing that literally gives me stress, getting backed up. So I try not to get into that, where you have angry patients sitting outside in your chair and you feel like, so yeah, just keeping an eye on the schedule really helps. Like, just anticipate you have a new patient coming in, so when to break your production so you can go do that. And just, so you really need to learn how to flow and manage the flow, because you're not going to see one patient an hour. There are going to be new patients, there are going to be some overflow patients. You sometimes are hygiene checks as well. So it's just getting a hand on that flow. So
definitely.
other than, there's really not much stress, honestly, but it's just a flow that you have to make sure that everything's done on time.
Right. No, of course. And you did speak about, the office dynamics and, having the right office manager to help with that flow. Speaking of staff, you're working side by side with your dental assistant constantly. Did you have any choice or say in who your dental assistant was, or if there was ever a reason there wasn't one, would you have say?
So yeah, in my office, we rotate. We want to make sure that everybody can work a designated column: production, overflow, x-rays, new patients. So if I were to just work with one person all the time, that person would just get used to me. And if they leave, then I'm in trouble. So we want to make sure that the staff is cross-trained and they can handle every sort of patient, every procedure, just whatever the office needs. My office also does 8 to 8 2 days. I don't do 8 to 8 2 days, but the office hours are extended. So me and my associate, we tackle that. So we want to make, and then you can't have a staff working all those hours. So there are times when somebody comes in the middle of the day or leaves early. So so I don't just work with one person. They have their schedules and they work every single column. So which I feel is better than just with one person, because if that person leaves, that leaves you high and dry.
Right. Definitely. So we had a couple, I'm trying to make the conversation flow. So I'm trying to think what would be the best one to ask. I guess jumping into the pandemic, we all had to go through that and are still going through it. How has the pandemic affected your work environment for you in your everyday practice initially to now? How is that?
So initially we did close down for 10 weeks. I wasn't working. I chose to stay home. In those early days, I think we had one associate or who was covering the three Cincinnati offices. There was this thing of PPE running out. And then, however, once we opened up last year in May, I feel we've become much busier than even before pandemic. And that's a big thing for Aspen. We were already busy. And I feel it just keeps going. And I think the reason is some of the smaller practices closed down during the pandemic. I know there are a couple where my office is, so we're getting all their patients. Most of the private practices don't have enough PPE to see a lot of patients. So we a lot of patients who have established dentists, but their dentist cannot see them for another 4 months or 5 months, and they need to be seen. So I honestly feel that I'm lucky that I was actually working for Aspen during the pandemic, because so many friends that I spoke to, they were struggling. the PPE issue, and like we don't have to worry about that, honestly. Patient flow, it's busier than ever before. So I think working for Aspen, I haven't really felt it, but I do know that there's certain private practices who are not seeing as many patients. They want to stretch out the PPE or various reasons. Like I hear from patients all the time and some of my friends. So yeah.
Yeah, we are at Aspen Dental. We're the second largest purchaser from Henry Schein. So that's
Next
why
to the US government.
yeah,
Yep.
next to the US government. I love saying it.
And Dr. Nadia, I don't know if you remember hearing that, but Cincinnati was the first market to be profitable coming back from the pandemic.
Yep. Yeah, like when we
in the
came
entire
back.
company. Mhm.
Yes, when we came back, it was so crazy. It was truly overwhelming because there were just so many patients. It's like, oh, that the first couple months were sort of rough in terms of so many patients needing care. First, closed at 3 months, and then some practices actually just closed down. Like, so yeah, it was really, really busy, very, very busy. But I think so far we've been good with supplies and PPE. So, we even get the shoe cover. So, so
But that just speaks to, the volumes, just because of how large our company is, the access that we get. These are things that a lot of people have to worry about, but when working with Aspen Dental, you don't have to worry about that. You don't have to worry about the supplies. Are things going to run out? Fortunately, we have a great relationship with Henry Schein. So it's something we're fortunate enough that we don't have to stress about.
Yeah.
Thank you both. Let's see. What do you think we can do as dental students in our school clinics to help prepare ourselves most for post-school practice? Oh, Dr. Nadia.
I would say try to treatment plan very comprehensively. Try to do, you do have stuff that you're required to do, but I would say try to do above and beyond. Try to get as much clinical practice as you can get. Ask once you're on certain times when you feel like you need help and there might not be somebody around to mentor you or help you. Get good with extractions, see if you can get training for implants, because that's the future. Invisalign, I feel like Invisalign is such a great thing that we do for our patients, and it's fair with Aspen because we're doing it for what, 2,400 some days. Like, it's so cheap. Nowhere else would get it for 2,400. But try to treatment plan comprehensively. When we see a patient, we honestly, even if they're there for one tooth, we do various treatment. Even if you feel like, oh, I don't know if they can afford implants or bridges, go ahead, give them that option as much as you can do. Don't focus on that one tooth only, just as much as you can. Think of the last semester as a residency, even if you're not going to go for one. Especially if you're going to start with a big corporate like Aspen or busier offices, it's the more skills you have, the quicker you will be, because like I said, sometimes there would be 3 or 4 patients that 1 hour needing your attention. And sometimes it can get overwhelming. You're like, oh my God, where do I go first? How do I handle that? But so as much practice as you can get, try to do more in an hour, challenge yourselves to face the real world, I would say.
Yeah, definitely. Thank you. Here's a question's a little bit different. When it comes to your work-life balance, what is it like? Do you have a lot of work to do from home after your work day? What is
Honestly, I don't have any office related work at home. I have home related work at home, but
You have a different kind of work at home.
I yes, that's more overwhelming than anything Aspen can throw at me. I have two little ones, so but I work Mondays I work 10 to 8. We have one late day a week.
Mhm.
And the rest of the days I actually start at 8 and I end at 4:30. I leave early. I take a shortened lunch because I have a bit of a commute. My associate is there from 9 to 6 with an hour break. I prefer not to take a full break and just leave at 4:30. I don't work Fridays anymore, but Fridays are half days. It's 8 to 1. I do work one Saturday a month. It's 8 to 3. So honestly, my schedule is not killing me. I mean, I feel great. I have time for my kids. Like I said, I get a 3-day weekend. So I did start off with full 5 days. And then once I had the associate, they asked me if I wanted to take the Friday off. And I said, sure. So
I think that's one of the great things is like the schedule is not black and white. There's a lot of gray area. And
yeah, absolutely.
if you have the right clinicians in place, I mean, we want to if we can get creative with the schedule, I think is what I'm trying to say. It doesn't have to be your typical 8 to 5, 8 to 6 office hours. You can get creative and have someone come in later and leave earlier or vice versa.
Yeah, absolutely.
There is flexibility in the scheduling that we try to help out with our doctors.
Yeah,
that's really exciting and kind of unique. You don't really hear that often with a lot of DSOs, but with Aspen, I do hear that often from all the AMCs I've done. A lot of the doctors talk about their ability to have so much flexibility. So, I'm going to do one last question. Let's see. Okay, maybe two. One is, what is your least favorite procedure in dental school and how has that changed?
in dental school, I would say maybe root canals, and I don't think that still has changed much. I and that's just a personal thing. Some people love it. I'm not a big fan of root canals. Like I said, if I'm loving extractions, that's like the opposite end of root canals. So it's just personally something that I never really much liked, especially molars. Anterior is still okay. But like I said, with root canal, and it still is the RCTs.
That's fair. But we do have specialists that you can refer out to.
Yes.
Which is pretty cool.
We do. Like I said, it with Aspen, it's not just you by yourself with the weight of the world on you. So if I don't want to do something, I don't have to do it. We stay enough that in-house. So like with the oral surgeon, if they're like impacted molars or like low sinus or something, I feel like I don't want to do, then the oral surgeon would do it. If patients want IV sedation, oral surgeon would do it. So I don't think we refer much outside unless we want to refer for endo retreat. That's the only thing we actually refer out for. Everything is done in-house and it doesn't have to be done by me. So
right. Someone just asked, would you recommend a GPR then?
I would. I think it's really good. I feel like the associates who come after GPR, they get into the flow of things quicker. You don't have to. I mean, you'll get enough clinical experience, honestly, that this will be your GPR. Honestly, this is like a GPR program. But like I think we had one doctor, she started as an associate recently in my office, and she had done her GPR, and within 3 months she was the MCD. They moved her to another office. And it's able to handle, and the office is doing great. So I would recommend going anywhere. The more clinical experience you can get, it's better for the dentist and the patients. So I didn't do it. I graduated from NYU in 2008, and then I started off in dental dreams, which was practice right outside Chicago. Like that was my GPR year. But I used to work crazy hours. Sometimes I would leave at 9 p.m. I used to work 10 to 8, 10 to 9 very routinely. It was crazy. I got burned out. So I wouldn't recommend that. But I didn't have kids, and I used to work like that. But yeah, I like my hours now a lot better.
That's awesome. Jeff, do you
Yeah.
have any from your experience with working with, recruiting for doctors and everything?
I mean, obviously I'm not a dentist, so it's like, to each his own, right? And if you feel, GPR is the right route for you, absolutely, pursue that. I've heard a lot of our other doctors say that, if you find a really good mentor doctor and a really good like MCD that in that
Yeah.
office, your associate position could potentially
Yeah.
be your GPR, as you mentioned, Dr. Nadia. And I feel like
Yeah.
you'd make like 3 or 4 times the amount of money.
True. I agree.
Coming out of school. So, but again, it's your preference. And I think the best thing that you can do again is shadow and, meet the team in place and just, find out if you feel that Aspen Dental would be an opportunity that you could really see yourself flourishing in.
Definitely, yeah. Okay, this is the last question. Dr. Nadia, outside of dentistry, who are you? What do you like to do?
I'm a mommy. If I get time, I'm honestly, I mean, I have an 11-year-old and a 4-year-old who keeps me very busy. You guys can tell I'm sitting outside. I'm hiding from my kids. So, but I love to
11
bike.
and 4, Doc.
Yes.
11 and
Yes.
4. Where did the time?
Right.
I was at your interview.
Right.
I was at
Yes.
Dr. Nadia's interview day.
Oh,
And
no
I
way.
came 11 and
My
4.
God. And my kids are actually doing online school. So not my little one, but my daughter. So it's home has actually been overwhelming. Not the office, honestly. Office I take as my respite or my break. But I'm very busy with my kids, with their online learning. I love to bike. But my kids are glued to me as soon as I come home. So it's pretty much about them, honestly, since the last couple of years. And that's okay. That's all right. Just very busy with family life.
Yeah.
I do have a ton of friends. I live in a great community. So we've got a very, very busy social life as well. So it's good.
That's awesome.
Not doing much traveling because of the pandemic, but yeah. It's like I said, a mommy.
You've got a busy life, Dr. Nadia.
Yes, very busy.
Very fulfilling, which is beautiful. So we are running out of time. We're at 9 o'clock. So I just wanted to let everyone that joined know that I will be emailing you in the next couple of days with the top 4 winners of the most questions asked, as well as the gift cards and everything. So aside from that, I wanted to thank everyone for joining, and then thank obviously Jeff and Dr. Nadia for taking taking time out of their evenings to talk about Aspen Dental and their careers and experiences. But if you do have any further questions, feel free to email me and I'll get in contact with Dr. Nadia. Or if it's recruiting specific questions, Jeff, and I'm sure a lot of you have met Jeff, unless, the pandemic, things have changed, but I'm sure you've met either of us, and we're both great sources for any of the questions you might have, or great people that can connect you with the right person. Jeff and Dr. Nadia mentioned shadowing opportunities, and that's something we do. So feel free to reach out about that as well. Anything you guys would like to add?
Ruby, feel free to add my cell number and my email to the follow-up email. And
Perfect.
any questions, I'd be more than happy to answer them and help direct folks to office shadows if needed.
Awesome.
Yeah, and you can send any questions to me. You can email them to me and I'll get back to you. I guess you could be in touch with them, whatever you need.
Perfect.
So,
Perfect. Thank you all. Have a good evening. And yeah, thank you again.
Thanks, Ruby. Thanks, Doc.
all right. Thank you.
Bye.
Thanks, both of you.
Bye.
Bye.
Bye.